recording. I just sent you all in the last 10 minutes in an announcement, Professor Ford's review from yesterday. All right, so now you have two. Okay, we're recording now. So we're waiting for two more students, but we'll get going. So I just sent you that recording. So now you have mine from Tuesday, Professor Ford's from yesterday, and I sent you an email this week that Professor Kershaw has changed her review to tomorrow morning from Sunday evening. Everybody get that email or announcement? Okay, they're all in your announcements. So she's doing hers tomorrow morning at 9, I believe it's 9 Eastern. So that's your last opportunity to attend a live review. Let's see. Get Erica in here. Morning, Erica.
Good morning.
Good morning. All right, so I don't think I have anybody else in the waiting room. All right, so anyway, that's the review update. Okay, so now you, as of this morning, you have 2 recordings. All right, so I encourage you to watch those. I got an email this week from a student about the Friday after Thanksgiving. So this is a good time for me to remind you that there is no class the Friday after Thanksgiving. Okay, is that next week? No.
Next to next week.
Next week is exam week. It's a week after that. Right? Okay, so no class. So we'll get that content covered. Actually, what I might do, because next week's exam week, which is 7, and then 8th is no class. And then in week 9, I think it's going to be too much to cover 3 weeks of content. So what I might do is do a recording for week 7 for next week. I might do a recording of the content. And then when we get to week 9, we'll cover 8 and 9. How does that sound? That sound all right? Okay.
Yes.
Yeah. So I think that's what I'll do, just so we don't have a crazy week 9. Okay. So I'll send a recording sometime next week of week 7, because you guys have been taking your exam. Okay. Remember, you guys are a Friday class, so you'll have the exam a week from today. If you get to the middle of next week and you're studying and you're stuck on any of the concepts, and we'll cover those, because we'll cover those today, because I want to go through the study guide, at least go through the structure of it and how I think you should attack it. But if anybody gets stuck next week with concepts that you're having a hard time understanding, please reach out to me, okay? We can schedule a quick tutoring session to go over whatever you're challenged by. Okay? You have all next week to reach out to me. All right? What else
Okay.
do I want to go ahead? Anybody have any questions?
Yes, it's me. Ryan is texting me and he said that he's just sitting in the waiting room and it's not letting him in here.
I don't have thank you. Thank you. I don't have anybody in the waiting room though. It will
Okay.
pop up. Hang on.
Maybe he in the wrong class.
I don't have her. Yeah, I don't have him in the waiting room. So make sure he's on. Oh, there he is. Okay, there he is. Okay, he's in. He
Okay,
just
thank
popped
you.
up in the wait. He just popped up in the waiting room now. So
Thank
thank
you.
you. And then anybody missing one student? That's okay. We'll keep going. Anybody have any questions before I go into my mantra of what's coming up in weeks 9, 10, 11? Hi, Ryan.
Hello,
How are you?
I'm good. How are you?
Good, good, good. Um, so we're in week 6 now. So next week is exam week. I hope you've all started working on some of your projects that are due in the next 3 weeks, right? We're going to spend some time today going through week 6 content. It shouldn't take us that long. And then I want to go through the HESI prep assignment. Okay. And I've had questions about that. What do I want in there? Remember, that's a study guide for you. So we'll talk about that when we get there. All right. So I want to pull that up and go through it. And then I want to go through the study guide for exam 2, or at least go through the structure of it. And then if we have time, I have a good test taking tutorial. It's from Elsevier. It's part of our instructor package, and it's about critical thinking, how to answer questions. All right, so I want to go through that. All right. So, does anybody have any questions about anything? Oh, okay, so week 8, you're going to be off. Once you come back on week 9, well, first of all, let me back up. Week 7, how are you coming on your group projects? Has everybody at least made contact with each of their group members and you're working on things?
Our group is done.
Oh, yeah, I saw a couple of groups have already submitted. Great. If there are any issues, let's see, it's due a week from Sunday. Okay. And remember 2 things about the instructions that need to be modified. It says in your instructions it's due on Wednesday of next week. I've given you till Sunday. Okay. I think I talked about this early in the term. It's not due till Sunday of week 7. And the other thing is there's no peer reviews. Okay. There's no peer reviews. That's why it can be due on Sunday. All right. So don't worry about peer reviews. Remember, everybody has to submit a copy. Okay. It's just not one person submitting. Everybody has to submit a copy because it has to ping in the grade book. All right, that you've submitted a copy. So I get it. I'm going to be getting 4 different copies of the same paper. I get it. But everybody has to submit. Okay. If you're having any issues with your group, just shoot me an email and I'll try and help facilitate what's going on. Okay. So that's week 7. Week 9 is your HESI prep, right? So don't be waiting till, that's why I want to bring it up today. Don't be waiting until week 8 to do it. Otherwise, it's going to turn into a very long, tedious assignment. Okay. And the longer you wait to do it, the more rushed you're going to be to do it. It's really not going to be a good study guide for you. If you're working on it as the term goes, it will be a good study guide for you. But it won't be if you're trying to just fill this in at the last minute. Okay. And then vulnerable populations assignment, that's due in week 10. That's your PowerPoint, right? That's your individual assignment, not a group assignment, individual assignment. That's a PowerPoint, 6 to 8 slides, right? Where you're picking a vulnerable population in your own community, your own zip code, and you're doing a research paper about that population. Okay. Some people have been confused about what's a paper, what's a PowerPoint. Okay. Your paper is your group assignment. and your PowerPoint is your own individual assignment in week 10 for vulnerable populations. So make sure you're picking a group, somebody in your population in your community. Don't do a paper that says the homeless population of the United States is so and so. The rate of teen pregnancy is so and so. That's general. Okay, I don't want to hear. It has to be something specific in your zip code. Think of a population that you would like to know more about. Okay. So it's going to get busy here in the next couple of weeks for you guys. So I just want to make sure you're getting ahead of some of these big assignments that are due coming up. Okay. Okay. All right. I need to go in and let's see. Okay, part of your readings this week were, let me go in and get it, were a module reading sheet on environmental and occupational health. Well, let me share my screen and we'll take a look at that. Okay, has everybody seen this or had a look at it? Okay, let's just start with some simple definitions. What's occupational health? Where is that focused on? If you're working in the occupational health setting, you're an occupational nurse, what setting are you in?
Your work environment,
The
What's
work
work-
environment,
like
right?
a
So
factory, or a dump site, or anywhere where you can work.
anywhere,
Yeah,
anywhere.
any hospital.
It's a occupational nursing, occupational health is in the work setting, right? Environmental health is in the community setting, but often they're used interchangeably. Okay. So what does occupational and environmental health nursing do? It's a specialty practice, right? It delivers health and safety programs for workers, worker populations, and the community. That's how it combines occupational and environmental. All right. Part of the focus is the promotion of health, restoration of health, prevention of illness, prevention of injury, protection of work-related environmental hazards. Right? So some of the roles that the occupational and environmental nurses have. Okay. Case management. What's case management? What's a case manager? What does a case manager do?
I can speak from the hospital point of view, like
Yep.
when patients are admitted on my floor. So it doesn't just end at the hospital. It's like if somebody needs to be like rehab, or somebody needs to have some kind of oxygen at home, somebody needs as aftercare of like a hospital or like a rehab or something, the case manager kind of sees to everything.
Yep.
Yeah.
That's exactly right. The case manager is the coordinator of care. All right. So usually case management is reserved for the very complex clients. Okay. So clients that are going to need a lot of preparation to go home. They need a lot of resources. Okay. So often you see nurses in a case management role. They coordinate the care, right? Let's take, for example, an occupational health nurse functioning as a case manager. Let's say there's a workplace injury, right? Somebody's hurt their back. They're going out and having surgery. Okay, that occupational nurse is responsible for documentation of the injury, monitoring the,
Incident reports,
pardon me?
incident reports.
Yeah, Yep.
No?
What happened? How did they get that injury? Okay. Um, following the employee through the surgery, when they're ready to come back, what are their restrictions when they come back? Can they come back limited duty or full duty?
Yeah.
Right? What re-education are they going to need?
Does FMLA come in that? FMLA? Does that come
Pardon,
in that?
pardon me?
Does FMLA come in that?
Yeah,
Like the leave?
FMLA. I mean, that's what he or she is looking at. Okay, so if you're the case manager in an occupational setting, you're looking at all those kinds of things. Workplace injuries, workplace hazards, accidents that happen on the work site. Okay? But one of the other things that occupational environmental health nurses do would be counseling and crisis intervention. Right? So yes, they're going to be working with clients that have work-related injuries. However, there's a lot of substance abuse, a lot of mental health issues that employees bring into the work setting, correct? Right? So they will be working with employees that may have substance abuse issues, psychosocial needs, maybe health and wellness promotion concerns. Let's say you have obese and unhealthy workers. I mean, the goal is to keep people in the workplace, keep them healthy, right? They will also be involved with whatever kind of leave they're taking. Like Aaliyah said, family leave, disability, they're involved in all of that. Okay, maybe what if they're working with employees that have mental health issues, substance abuse issues, they're getting them involved with the EAP programs. So everybody know what an EAP program is, Employee Assistance Program. Okay, typically the larger organizations have EAP programs on site. Some of the smaller organizations have referrals out to EAP programs. The other role of the occupational environmental nurse is health promotion and risk reduction. Maybe they're doing educational seminars or programs or pamphlets or whatever on positive lifestyle changes, balancing work and home, right? Trying to help lower the risk of disease and injury. And then the other area that they have to be familiar with is legal and regulatory compliance. Is everybody should have heard of OSHA. Anybody tell me what OSHA is and what they do? What's OSHA?
It's
Does
basically
it
a federally.
affect the in like the healthcare settings? Or
Say
like
that again?
I said, does it help protect like the healthcare workers?
Okay, so part of it, yes. So it's the Occupational Safety and Health Administration, OSHA. Okay, they're responsible for enforcing the guidelines that have been the environmental guidelines in the workplace. Okay, so every kind of work area has a set of safety, occupational, environmental guidelines that they need to follow. Right? It's keeping the workers safe in the workplace, right? Or keeping visitors safe when they're traveling through the facility, keeping clients safe when they're in the hospital. Okay, so OSHA will monitor how each organization is following those guidelines and those laws and the rules. So let's say you have a unexpected death in the OR, or you have several falls of patients, or you have needle sticks. You have visitors falling coming in the front door. because of whatever, ice buildup, whatever, steps. Okay, those are all occupational safety hazards, whether they involve the employee, the patients, people visiting. Okay, so that occupational environmental nurse is going to be involved in trying to sort out what has happened, what led up to the injury or led up to the incident, what happened during the incident, and what is the follow-up going to be. Does that make sense? So basically their job is to ensure workplace safety, workplace training. I mean, when we all take a new job, we have to do occupational health stuff, right? We have to get our TB screening test. We have to provide documentation of immunizations, right? Those are all legal and regulatory compliance issues. All right, so occupational health nurses work with the employers on compliance with regulations that have been set up for them that affect workers in the workplace. The other big role of the occupational environmental nurse is that they need to be aware of the requirements of everybody's job description. Think about a hospital. Think about all the job descriptions in a hospital, all the way down from the OR, radiology, patient transport, environmental services, food services. Everybody's got a different job description. And what risks are embedded in those job descriptions that the occupational nurse needs to be aware of? Let's say you work in a plant, a really, really noisy plant. What kinds of protections need to be in place for those workers? Let's say you work in an environment that's very hot or very cold. What protections need to be in place for those workers? Let's say you work in a facility or a place where it requires heavy lifting all the time. What training is in place that those employees have adequate training on proper lifting techniques? I know if you're working in the hospital, I know, well, if you're, sometimes it's hard to think about all these workplace injuries. You just kind of take for granted that everything goes along and everybody does their job and there's no issues. But occupational health and environmental health is huge. Okay, that particular person or department is a huge part of the healthcare team, right? Because think of all the additional expenses, right? If visitors are falling, if patients are unexpectedly dying, if there's an increase in needle sticks, if there's an increase in back injuries. I mean, think about workers' comp. Think about how many people go out on workers' comp for injuries at work. And that's what occupational environmental health is all about. Okay. So here's your actual notes for this week. Okay. So let's see, we haven't covered yet. Right. So the nurse, if you are occupational health nurse, think nursing process. You've got to do, let's say you're going into a new job and you're the occupational nurse. Okay, what do you need to do? Well, you first need to conduct an assessment of the workplace, right? What is your windshield survey? What is it what kind of work setting is it? Is it a hospital? Is it a plant? Is it kind of facility is it? What are the requirements of various jobs? What are the potential hazards? Occupational and environmental nursing is heavily focused on safety education and equipment. Okay, so the occupational nurse sees the various kinds of injuries and diseases that people can acquire from their employment. One thing to remember is there is no work setting that is completely risk-free. No work setting is completely risk-free. Every single industry has certain risks for serious hazards at work. We talked about case management, coordinating and managing the care of ill or injured workers. Counseling, crisis intervention, we talked about that. Oh, shoot, we didn't take our quiz. Okay, that's okay. Let's just finish with occupational health and environmental health, and we'll take our quiz. So I mentioned this a little bit. So not only are we dealing with kind of crisis management when there's an illness or injury, but we're also trying to do primary preventative interventions. You know, teaching about positive lifestyle changes that may help lower the risks of disease or injury, create an environment that provides a sense of balance with family and work. Smoking cessation, exercise programs, nutrition, weight loss, stress management. We talked about legal and regulatory compliance. Detecting hazards in the workplace. You know, what if you work in an environment that has lots of chemicals and you're at risk for a chemical exposure? How do you train and educate the employees on the safety of handling chemicals? Okay, here's a primary, secondary, tertiary prevention, so examples for occupational health. So maybe teaching coping mechanisms. You know, a lot of people are very stressed when they come to work, right? Providing healthy diet education, educating on the use of proper lifting techniques, trying to prevent something before it happens, right? Secondary, an example would be screening for hearing loss. So you work in a noisy plant, blood pressure screening, screening for stress and burnout. Okay, this is in the workplace. And then tertiary, we have to assume something's happened. They've had an injury, they've had an illness, and a tertiary would be maybe a limited duty program for workers that are returning from illness or injury. Providing illness or injury education. Let's say somebody had carpal tunnel surgery and they're coming back. What needs to be in place for them to successfully transition back into work? What are the physicians' recommendations to release for work? Are they splints, wrist splints? Is it a different kind of workstation setup? And we don't really think about this every day. But occupational environmental health is a real benefit to employers. Okay, let's just go through environmental health real quick. We're just kind of split them up here. So we know that environmental hazards are responsible for over 1/2 of the total injuries, diseases. Okay, they contribute to over 80% of communicable and non-communicable diseases or injuries. Now, who is the most vulnerable population for environmental hazards?
Children.
Kids.
Children, yeah.
Yeah, why?
Because the immune system.
To lead and all that stuff.
Immune system and the liver can't.
Immune system? Yep.
The liver can't handle all of the hazards.
Yep. Okay, so kids are much more vulnerable to environmental hazards. Exposures are more likely to lead to adverse health outcomes. Okay, environmental health is determined by several things: genetics, socioeconomic status, and environmental exposures. And then you may ask, why would socioeconomic status, financial stability influence environmental health? Well, those at risk, those who live in poverty, may be more likely exposed to environmental hazards, maybe due to crowded living conditions, maybe living near, I mean, think about environmental health. Think about where you live. Think about where you live and the environmental hazards within your community. You know, do you live in an agricultural community? Do you live in a community that's a transportation hub, maybe near an airport, busy bus terminal, trains? Do you live near a power plant? Is the community you live in industrial? Okay, so depending on where you live will determine on what increased exposures you have. Okay, do you live in an older home that may be at risk for lead exposure? Okay, so when you're conducting your environmental assessment, we want to know where people live, where they work, where they go to school, where their kids go to school. What's their dietary history? Like I said, do they live near factories? Do they live near waste sites, dump sites, major transportation routes? Okay. In rural areas, there's a lot of overhead spraying of pesticides and herbicides. That's certainly an environmental risk. We know that lead-based paint was used in homes before 78, right? We know that kids eat paint chips, falling off windowsills, do they not? Schools, homes, daycares. Okay. Think about environmentally, think about all the supplies and items you have in your own home, in your garage, in your shed, wherever. Right? All the kinds of pesticides we have just floating around the home. Right? Maybe gardening supplies, home cleaning supplies. They're all around us. All around us. And then the other thing to think about when we think about environmental risks, we think about air, water, soil, and food. And don't forget food. Food can be an environmental risk as well. When I go to a drive up or go to a restaurant, I just make the assumption that everything is being prepared as it should be. The right temperature, using the right protective equipment, cleanliness, right? But food contamination happens. Okay, so we have to be mindful of that as an environmental risk as well. Okay. Before we start our barriers to learning, we'll go back and take the quiz. Does anybody have any questions about environmental occupational health? Really important. You don't really think about it. You know, if you're working in the hospital, you're not focused on environmental risks, right? But if you just think about driving around your community, what do you see? Is it dirty? Is it clean? Is it a high density of population living in close quarters? What are the roads like? Right? What are there places for people to get exercise? Are there parks? Are there walking paths? Right? What other things would affect the environment? What do you think? As you're driving around your neighborhood, what do you see as environmental risks? Nobody has any environmental risks in their community? I
I,
live near a major highway that I mean major highway, I-70 goes
Noisy, Professor.
noisy.
And
Think
Yeah,
about
main
it.
I live
construction,
short.
main
I live short to the
construction.
airport.
Yeah.
The pollution from all the cars on the freeway.
Air pollution. Right. Well, here it's estimated that two things. It's estimated that 50% of Americans live in areas where the air quality does not meet the national standards. That's a lot of people, right? And it's estimated that 30 million Americans drink water that does not meet the safe drinking standards. So we just don't think about it every day. We just kind of go on with our daily lives, right? Not thinking about environmental risks, environmental exposures, but they're
Where we
all
live
around
at
us.
in North Pennsylvania, in northeastern Pennsylvania, American Water, they're always sending us emails saying the water is not good to drink. It seems like every month we get something. The water
There
is
you
not
go.
good and it's brown,
Hmm,
bottled water only.
really? So, so Teresa lives in a community that has water. Think about it. I mean, wow. What has anybody ever seen the movie Aaron Brockovich? Anybody ever seen that movie?
yeah,
It is the epitome of an environmental disaster. Okay, it's about a small community in Texas that a power plant or
Julie
whatever,
Roberts plays in it.
yeah, is illegally dumping contaminated things from their plant into the water. Well, this small town in Texas, people start getting kids and adults and babies, fetal development, start getting just this outrageous amount of cancers. And these attorneys track it back to PG&E, Pacific Gas and Electric. They track it back to them that they had contaminated the water knowingly. It's an environmental disaster. Okay, so if you're out in the community and working in public health, environmental health becomes an important part of your role, monitoring environmental health and risks and exposures. It's serious, very serious. We don't think about it. I just drive around, right? Do my thing, as we all do, but you don't think of how many environmental exposures are out there for us, right? Just gives you something to think about. All right, let's take a step back. Let's take a step back. Are we on quiz 4? Quiz 4 is all ready for you. It's open. Why don't we take it? Let's see, it's 9:30, 9:40. Let's take till 9:55. Let's take 15 minutes and do the quiz. Okay, if you need more, we can go 5 more minutes. All right, remember, sorry I forgot about this at the beginning. I did forget about it. So let's just take it now. Make sure you hit submit when you finish, stay on camera. When you're done, just keep your camera on if you need to go take a break, whatever. All right, so go ahead and start that. Take your time. Is there anybody else still taking the quiz? Okay, Aaliyah. Okay. As soon as Aaliyah's done, we'll go through it.
I'm done, ma'am.
Okay. Okay, great. Looks like everybody's done. So if everybody could come back on camera, that'd be great.
Interesting.
How'd you guys do?
Much better. Oh, I knew it.
Good.
Why do I always second guess myself?
I did horrible.
Who said they did horrible? Okay,
I second guess myself.
let's go through it and see what we missed here. Hang on. Okay, everybody see my screen?
Mm-hmm.
Okay. All right, so which statement is true regarding children and environmental health hazards? And I'd like everybody to participate here. Okay, everybody, I wanna hear from everybody here. What statement is true regarding children and environmental health hazards? What's the correct answer?
2. No, 3. 2. Is it? Wait,
B.
let me check. Yeah, B. It's in the notes.
Did anybody answer
Yes.
anything else other than B?
I think I said D.
Okay,
B.
right, and why is B the right answer?
The product of the ground reason this toxic exposure because of the ground.
The ground has chemical, no?
The what?
The ground.
The ground, the toxic
Kids.
exposure.
It's toxic, it has chemical.
Yep, picking up stuff. Right, putting it in their mouths. Right?
Yeah.
Okay. Number 2, you're doing a home health visit for a pregnant client. The nurse notes the client's husband regularly uses pesticides at work. Which nursing intervention is a priority? So let's break down this question before we answer it.
Yeah. It's
If you
number
were
one.
hang on, if you were using your highlighter, and this was an exam question, what in this question would you highlight?
Pesticides and pregnant client.
Okay, what else? There's one more.
Priority.
Intervention.
Priority.
Priority.
So you know your client is a pregnant client. The issue is pesticides. And what intervention is a priority? So what's the correct answer?
Okay.
The one. Number
One.
one.
The first one.
A.
Okay. And tell me why A is the correct answer.
Well, the clothes is contaminated.
Okay. Okay. What could be potentially be a correct answer?
It could, but it's not priority.
Oh,
There you go. Kayla just nailed it.
yeah.
There you go. Because I had students that select B. And when we go to review it, it's looking for a priority. Yes, B is important, but it's not the priority.
But it
Okay.
makes no sense if the husband changes outside, because the exposure to pesticides is what we're talking about, right?
Well, yes, but B, you could also use the same argument with B. But it's asking what's the most important.
I guess, yeah.
Okay. So Kayla nailed it. B could be right, but A's a priority. 3, the home health nurses working in a community with high rates of complex chronic illnesses and neurological disorders. Which environmental characteristic is a priority? What would you highlight in this question before you
Priority,
answered it?
priority,
Okay, priority is one part. What else would you highlight?
complex chronic illness and neurological disorders.
Mhm.
Community.
So, community, okay?
It's
So
a lot of people.
a lot of people with a lot of chronic complex illnesses and neurological disorders. All right, so before you even look at the answers, before you even look at it, what are you thinking? Maybe they live in a community that, obviously they live in a community that has a lot of environmental risks, correct? So what would be the logical answer to that?
The manufacturing plants.
Okay. Does everybody understand why that would be a priority?
Could you explain me the first one? What does it mean, guardrails along all roads with a significant drop off their side? What does that mean?
So, what do you mean? What is it?
What is it like? What is that? Guardrails along
So-
all roads with a significant drop off.
Right? So what that means is barriers. Barriers are built along the roads that have a significant drop off
It's a
so
sign.
that if you
Is it
get
a
in it,
sign? Is it a
pardon me?
sign? Is it a sign or something that says you can drop off stuff?
No, they're barriers built along the road so that if there's a drop off and you have a crash, you don't go over the side of the hill, you go into the barriers.
Oh. Okay. Okay.
Okay, so the presence of several manufacturing plants near the community's river may be contributing. What's the priority? Right? Maybe contributing to the complex chronic illnesses and neurological disorders, right? Number 4, the nurses reinforcing education about the diabetic diet. Which client statement indicates a barrier to learning? What's key about this
changed my answer.
question? Hang
I
on,
changed my answer. I hate it.
hang on. What about what about this question sticks out? Is this a positively framed question or a negatively framed question?
Negative?
Anybody else want to jump in?
I would say it's negative because it's asking for a barrier.
Right. So
Like,
what are you
what
looking
would-
for? So you're looking
What would
for,
stop that person from learning properly was trying to be taught?
right. What statement by that person indicates that they're just not hearing you or they're not getting it? Right?
I just thought he was being smart and he was like, I get it. So English is my primary language. So what are you trying to tell me? I did put the right answer when I went up to English is my primary language. I thought he just didn't want to hear,
Okay. What's the correct answer?
4.
Okay. Why, Tricia, let's go along your thinking. Why is 4 correct? When they say that,
Because-
go ahead.
Obviously, that diet has nothing to do with what we're talking about at the moment. So I would just be like, okay, let's go over this again. As the
Exactly.
nurse.
Exactly.
I was going back and forth with that one also. I just was reading it wrong.
Okay. So after you do all your teaching about a diabetic diet and your client turns around and says, I think I'm just going to do a keto diet instead of this one. That's a barrier. They didn't hear you or they didn't understand you.
Okay.
Okay.
Mm.
Or we'll talk about it when we get to teaching, but maybe there's a language barrier. Maybe there's a reading barrier. Maybe there's a comprehension barrier. That's what you need to figure out. After they say this, you're thinking, what's going on here? Are they being defiant? Do they just not understand? Did they not comprehend what a diabetic diet was?
So,
Okay.
so Miss English, if it was something else, English would be a barrier. Like, would you be smart and say English is my language? No? I'm just thinking why I thought of that. That's all.
English is my primary language.
I just thought
Okay.
he was being funny, and he was like, okay, I understand, so I'm still gonna do what I want to do. You know what I'm
I
saying?
did think like that also, so I did
Yeah.
go back and forth between the two, but
Me too, see?
I get it now. I understand now.
Yeah.
Okay. Which nursing intervention will enhance the learning of a client who speaks English as a second language? Right. So one of the biggest barriers, and we'll talk about this when we get back to the notes, one of the biggest barriers for learning is low literacy. What do I mean when I say low literacy?
Like no education at all, like basic education, not going to school.
They can't read as well.
Right.
Maybe they can't read, maybe they can't comprehend, maybe they don't understand the language. So what would we do? Will we try and provide them a recording to view later? Well, no, that's not going to help them if English is their second language. If they don't speak English.
You're gonna get
Right.
a translator, or you're gonna try to put it in something in their language.
Exactly. Create a pamphlet in the client's primary language.
Yep.
Okay. So C doesn't matter if it's not in their primary language, including a family in the teach back session. Give a client a dictionary. That doesn't even make sense. All right. So we are working with and going to be working with lots of different clients that have a language barrier. When we say language barrier, meaning English is not their primary language. So how do we still get to them? How do we still teach them? How do we still make sure they have an understanding of their injury or condition or disease? Well, one of the first steps we can do is create information for them in their primary language. Does that make sense? The home health nurse is reinforcing education on the use of a glucometer. Which approach would be most effective? What would you highlight in this question?
Most effective.
Most effective. Exactly, Ryan. Right? So when I know you've learned about teaching in your other classes, what would be what's one of the most effective ways to teach?
Is to teach back. The person should teach you back what they done.
The teach back method, right?
Yeah.
So you're demonstrating and then you want them to re-demonstrate to you. Okay. Yes, you could provide a pamphlet describing the function. Sure, you could do that. You could refer them to a client support group. You could create a video or ask them to go on YouTube and look at how to use a glucometer. But the question is asking what is the most effective. So this is a good example, and we've had these before, of a question that there's more than one answer that looks like it could potentially be correct. So if you did your due diligence when you read the question the first time and you were using your highlighter or writing down important words or phrases, you would have seen most effective. It's not that the other three couldn't be effective, but what is most effective? Does that make sense? Okay. Question 7. Home health nurses reinforcing education for an 8-year-old client with type 1 diabetes. Which approach is most effective? So using your highlighter, what is important to pull out of this question?
An 8-year-old client.
The client's age.
Mm-hmm.
Okay. So thinking about the client's age and how best they might learn, A is the correct answer,
Mm-hmm.
right? Teaching through play with toys or dolls. If you think about an 8-year-old, they cannot handle long comprehensive sessions. We would certainly not want to just teach the parents and not the child, because with diabetes, you're wanting the child to be involved in all of the teaching and education because you're trying to move them towards independence and caring for themselves eventually. And then a kid that's 8 is not going to be reading pamphlets. Okay. Which nursing intervention is a priority for a client who is not motivated to learn? Motivation is a huge barrier in learning, just like literacy is a barrier to learning. Language can be a barrier to learning, not speaking the primary language. Motivation is also a huge barrier to learning. So, which nursing intervention is a priority for a client who is not motivated to learn? We talked about this in a prior class, or a couple of prior classes. What's the most important? What's the most important thing to do off the bat when working with a client?
Establishing trust.
Trust.
Exactly, Caitlin. Establishing trust. Okay, the better rapport, the better trust the client has for you, the more open and honest and direct you can be with them about their condition. Some of the what are some let's, since we're here with motivation, why do we think that
What?
why do we think that so many clients lack motivation to learn about what's going on, learn about how serious their injury is, or how high their blood pressure is, or how
They have
serious their
low
heart
esteem.
disease is? Go ahead, Caitlin. You look like you're gonna.
They're in their like denial phase of their disease process and like trying to understand it themselves.
They have low esteem, like they totally
Low self-esteem.
Yeah.
Yeah. What else?
They don't want to be judged.
Maybe fear.
Yeah, they don't want to be judged. They have fear.
Okay. So what are some of the things? What I know I'm getting a little bit off here. What can we do? Let's assume we have established trust and rapport, and we have a good feeling that the patient trusts us. What would be ways to motivate the client? What could we do? Motivation is a huge issue, especially in the rural setting.
Like give them that comfort, like let them know that you're there for them, that assurance.
Maybe asking open-ended questions like what would help them more or something like that.
Yep.
Listen to them. First listen. Be a listener more than a talker.
Yep.
Right?
Kayla, maybe explaining to them the seriousness of what's going on, that high blood pressure is going to lead to this, and this down the road. Maybe if you're talking with kids that are very high risk for obesity, talking about the health effects long-term of obesity. Okay, how do you get a bunch of high school kids to be motivated? I mean, think about it. Your clients can be, when I was in the schools, my clients could be a preschool class, could be a first grade class, could be a middle school class, could be a high school class. How do you motivate high schoolers to take their health seriously? Right? So when we're thinking about education, we have to think about who, kind of reading the room, if you will. Who are our clients? How do we teach them? How do we motivate them? Okay, question 9. Occupational nurses caring for a client who reports lower back pain that is worse at the end of the workday. Which nursing intervention is a priority? What would you highlight in this question?
So
Low-
I'm
Go
sorry.
ahead, Caitlin.
Yeah.
Go
Low
ahead.
back pain, that's worse at the end of the day.
Okay. What else would you highlight?
Priority, the occupational health nurse.
Okay, we know we're talking about occupational health here, so we know we're talking about the workplace. Right? So somebody's complaining of lower back pain that's worse at the end of the day. And we want to know which intervention is a priority. Before even looking at the answers, don't even look at the answers. Just think out loud. What's going on?
But Miss Marvel, I wrote the right answer, but I changed it. I changed it because I saw which nursing intervention is priority. I knew that it was happening because of the lifting. Obviously, he's lifting something wrong. But I changed it because it says priority. Then I said, okay, they already know he's got bad back pain and all that. So then they have to get some medical, advice before they sustain further injury, and then OSHA would be involved. That's what I was thinking.
Well, you're thinking way too much. That all of what you just said isn't even in the question.
Okay.
The lower back pain, remember that rule of thumb. If the information is not in the question, it doesn't exist. Right? So you're overthinking, Elia. It's simply saying somebody's reporting lower back pain. It's worse at the end of the workday. So think about what might be going on. Maybe they're lifting in the wrong way.
I wrote that. I wrote my first answer as lifting, but then I went back to he's already lifting it, so his back is hurting. So then I said the priority would be to, get the expert medical evaluation to further help him.
But why do we need a medical? It's asking which intervention is a priority. So with all that we know that's in the question, we would assess for lifting techniques or safe body mechanics. Okay. If it may be as simple as re-education, as re-education for appropriate lifting techniques. We're far from asking them to obtain a referral for an expert medical evaluation. We're not even sure what's going on yet. It might simply be technique, maybe a little bit of re-education. Okay, we're certainly not going to do A. We're certainly not going to do C. And we're certainly not near needing to do D. Okay. We simply need to do an assessment of lifting techniques to see if that's the issue. If it is the issue, then re-education. If it's not the issue, then we look at what would be plan B.
All right.
Okay? Does that make sense to everybody? Question 10. Which statement is true regarding the scheduling of client education? Are we focused on what's convenient for us or versus what's convenient for the client?
Client.
Why is that?
It's just the patients come first.
But I think of the discharge nurse rushing in to review discharge instructions real quickly because they have 5 other patients and somebody needs to get down to radiology, somebody needs to get their medication, and we're rushing in doing discharge teaching that may not be at the most convenient time for the client. That happens all the time. Right? And so we need to be mindful of maybe checking in with the client to find out when would be a good time to go through your discharge paperwork, when would be a good time to review how to change your wound dressing. But maybe they want somebody else there with them that's going to be assisting them when they get home, right? So we need to make sure that they are in the most positive and comfortable frame of mind before we do teaching. All right, does that make sense? All right, let's go back. Let's finish up our barriers to learning, and then we're going to go to the HESI prep. We've already covered most of this, right? We know that patient education is one of the most important roles of a nurse, right? Why do we educate? We're educating to promote health, prevent illness, prevent injury, improve health-related behaviors, try and enable patients and their families to be able to care for to be able to be informed about their health conditions and be able to try and take care of themselves independently, right? Right? We want them to take personal responsibility for their health. That's our goal, right? If they take personal responsibility, it's going to be the chances of us better outcome are much more successful if they buy into the responsibility for their own health, right? Education empowers clients to education empowers our patients with the knowledge and motivation that helps them to take personal responsibility, right? We are educating in every role we work in, including as community members, right? Everybody's always running to the nurses, right? In the schools, if they know you're a nurse, all the parents are running to the nurse, right? And we talked about low literacy. One of the most important learner-related barriers is low literacy. Right? Nurses often work with populations who are either illiterate or have low literacy levels, right? Maybe in some cases they're embarrassed to admit they can't read, or they're embarrassed to admit they don't have that they don't speak the primary language. Okay? Maybe it's kind of fake it till you make it. Maybe, how do you ensure that they are either they're understanding and comprehending, right? Maybe you ask them to read back something to you, right? Or maybe you read something to them and ask them, what that means, right? We also, in barriers to learning, we have to assess the patient's, the client's readiness to learn. And here's your motivation. Motivation plays a large role in effective learning, right? We want them to return to independence, return to their home, the comfort of their own home. And often that's a motivating factor, right? As Caitlin said, we need to work with show them the advantage. Number one, show them how serious things may be. We need to to help them learn what the advantages of taking care of themselves are, right? The other barrier is cultural. Okay, we work with many, many different cultures, and the many cultures we work with have different values, beliefs, practices, right? So one of the things that we try and do is as nurses, we try and incorporate as many values, beliefs, practices that culture has into their healthcare plan. May not be able to be 100%. We should try to incorporate what their cultural values are, right? And then another barrier is lack of confidence. Somebody already mentioned that. Lack of self-confidence. I'll never be able to do that. How do we deal with that? Maybe praising and encouraging and trying to be as positive, but a lot of clients when we're teaching lack the self-confidence. I'll never be able to figure out how to take care of my diabetes. I've heard that from kids in the schools that are recently diagnosed with diabetes. Oh, it's too complicated. I'll never be able to do it. Well, you will, and we need to figure out how to help them move forward. Okay, there's 3 ways that we learn, thinking about education here. We learn visually, what we see. We learn orally through what we hear. And then we learn kinesthetically by actually hands-on what we do, right? Although we have all these 3 within us, we usually have one kind of dominant way of learning. I'm a hands-on learner. Okay. Some of you may be, you have to see something or hear something. Okay. There's three different domains that we use as how we learn. We have a cognitive, affective, and psychomotor. The way cognitively is the thinking part. Okay. So we hear the instruction or read the information. We understand it, memorize it, and then we can use that information to solve problems. Okay. So it's the thinking part. Affective is the feeling part. Okay. What are our attitudes, feelings, beliefs, values? It does affect our ability to learn. Let's say people are going to a conference on a subject that they don't necessarily agree with, but they have to go as part of their training for whatever work. You know, maybe their attitudes, feelings, beliefs about that particular topic will affect how much they get out of that training. And then psychomotor is the doing. All right. So that would be showing somebody, that was one of our quiz questions. Psychomotor, demonstrating how to use a glucometer and have them demonstrate back. It's the doing. All right. It's them practicing over and over again how to use their glucometer. Okay. I'd like you to have a look at the prevention in education. If you reviewed your notes, you've already reviewed these, but these are some good examples of primary, secondary, and tertiary interventions with regards to teaching. Okay, so I'm going to have you look at that on your own because I want to move to the HESI prep. So does anybody have any questions on the content? Okay, let's move to the HESI prep. Okay. So as I've said before, I update this really every term. Okay, so after last term took their HESI, I can go in, well, you guys can go in too because of all your remediate. Now, you guys can't go into the community, but think of all the HESIs you took last term. When you go in and do your remediation, you know what topics have been asked, right? So I can go in and see a list of topics that have been asked about. I can't see the questions, but I can see the topics. So these boxes here represent questions or represent topics, right? So as recently as last term, there was an anthrax question asked. Recently as last term, there was a question asked about level 1, 2, 3 phases of disaster. So a question about disaster planning, red tag triage, disaster communication. Okay, so this is as close that I can get to helping you on what topics are covered. Okay, now all these boxes, we haven't covered all these boxes specifically in class, but we've covered the concept. Does that make sense? So between your three books, your fundamentals, your med-surg, and your maternity peds book, all the information is there. Okay, so the goal, remember, this is your study guide. So you're going to get out of it what you put in it. Okay, so when I say in the directions, use the nursing process. Well, if you have a particular, well, the other thing too, remember, is this HESI is very med-surg focused. Okay, you see, well, anthrax, but down here in your home health, very med-surg focused. Heart failure, NG tube feeding, below the knee amputation, COPD, cirrhosis, cabbage rehab. Okay. Those are all med-surg focused. So for those particular clients, so what would you put in this box? Let's say it's med-surg focused, you're thinking nursing process. Tertiary prevention post-CABG rehab. What will we be thinking there? They have had the CABG, they are home. So what kinds of things, what kinds of nursing interventions would be in place? Precautionary, that you would have to be keen on when doing a home visit with a post-CABG client. Same with post-arthroplasty. What are you looking at in your assessment? What would you be looking at to make sure things are progressing in recovery? What would be some red flags? Does that make sense? If you're looking at COPD regarding ADLs at home, what are we thinking here? Well, are they on oxygen? Do they eat meals? Do they eat frequent short meals? They keep their oxygen on during meals. How do we help them maintain their COPD at home? Okay, so like I said, all of these boxes represent a question. I don't know what the questions are, but what do you want to know about each of these topics from a nursing process assessment? So like anthrax, I would want to know what somebody presents with, right? What are the symptoms they come in with? How is it treated? How do you protect yourself? Right? Red triage tag. Well, we know there's 5 different tags. I would know what the patient's condition is with a red tag. Okay. So what questions do you have about this? Again, it's what you're going to get out of it. This is your own personal study guide. Okay, I don't need you to list out A and D and P and I and E. I don't want you to do that. I just want you to have general knowledge about each of these concepts. But there's, other than providing you the topics, you have to come up with potential questions in your mind.
I'm sorry, you said this one is due when?
Week 9.
Okay, thank you.
Okay. Has anybody started working on it? And how is it going? If you have, how is it going?
You're right. It's more. You're
Pardon
right.
me?
It's more research. It's really a lot of stuff we have studied.
Yeah. Say that again?
Together, we're just putting it together now. And
Yeah,
it's going to,
exactly.
it's
Exactly.
going to help us
I
big
mean,
time.
there's certain topics we haven't covered yet. We haven't covered disaster. I think that's in week 8. We have covered health promotion and teaching,
Right.
right? We have covered home health. I think that's coming up. So there are parts that we haven't covered yet, but you can work ahead, right? You can work ahead. You've got the books, you've got the readings assigned. Okay, all of this information is in your course material. Okay. So has anybody started working on it yet? And tell me how it's going. I just don't want to make this bigger than it is. Okay, what do you need to know about each topic? And be prepared to have a question about it. Nobody has started working on it yet?
I have. I'm like 2 pages in though.
Okay, how's it going, Ryan?
Yeah, it's going pretty okay.
Okay.
It's just a lot of like time searching all these books and everything, looking it all up, trying to find everything I need to know about every topic and subject matter.
Yeah. One of the things I told my Monday class I would do, and I still haven't done it, so I'll do it today, and I'll send it out to you guys as well. I have some great samples from the last couple of terms of students completing this. And so I can send you out some samples. But again, you're going to get out of it what you put into it. This is your study guide. That's what you have to remember. This is your own study guide. This is what you'll be using. Okay. Okay, let's jump to the concept guide. Okay. So it's organized in a pretty easy way to jump through, right? You got your concepts for week 4 and 5, which we covered last week, and then week 6, which we covered today. I've copy and pasted all your readings in here, so you can jump right back. Okay? So with each bullet, the information is given to you. I'd like you to think about, okay, she's given me this information, so what's she going to ask about? All right, so let's just take the first bullet. Vulnerable populations often have poor health outcomes compared to other people in terms of morbidity and mortality. Right? These groups have a high prevalence of chronic illnesses, hypertension, communicable diseases, TB, hepatitis, STDs, upper respiratory, and so on. Okay? They also have a higher mortality rate than the general population. Maybe factors such as poor living conditions, diet, health status, crime, violence. So, after reading that, what am I asking you to know?
The vulnerable population is exposed to so many of these diseases because they don't have the resources.
Be more specific. What am I asking you to know? Give me a question. Why do vulnerable populations have poor health outcomes? Right? What do vulnerable populations have a high prevalence of?
They have a high prevalence of poverty.
It's right here. Prevalence, chronic illness, hypertension, communicable diseases, TB, hepatitis.
Mm-hmm.
All right. Why do vulnerable populations have a high mortality rate? What causes that? Well, poor living conditions, diet, health status, crime, violence, including domestic violence. All right. So there's lots of information in there, and there's lots of ways to ask about it. And I've told you before, told you with exam 1, if you have a good understanding of this guide, you're fine. You'll be fine on the exam. Okay, let's go to pregnant adolescents. Okay, let's go to this bullet. Postpartum visit with a teenage mom. Primary goal would be to assess how much the mother knows and understands about the needs of the infant and the development. Such knowledge avoids unrealistic expectations and frustrations, which could lead to child abuse or neglect. Primary goal of a postpartum visit would be to assess knowledge regarding normal growth and development. Give me some questions.
What would the nurse assess while visiting the postpartum mother of an infant?
Yeah. Yep. When the nurse is doing a postpartum visit, what is the most important thing to assess?
Isn't it the fundal massages?
What?
Living conditions.
Yep. Okay, so let's look at this one. A direct correlation exists between poverty and poor health outcomes. Poor health teens are 3 times more likely to drop out of school as their counterparts. Okay.
This is the first exam
When
as well.
programs that assist the mother to complete her education are instituted, chances are increased for a better future, which improves the health care over the long term. It's important to keep that pregnant adolescent in school during pregnancy. Have her return to school as soon as possible after birth. Okay, what are some questions? What's the biggest risk factor to a pregnant adolescent?
Them not graduating from high school.
Yeah, exactly. Makes sense? So as you read each of these, think about the information being given and what questions could be asked. It's all right in here. Okay. And then the last thing I want to review with you guys is this critical thinking when you're tackling questions. There's 4 things, and I've reviewed this before, but I'm putting it all together here. There's 4 things to think about when you're answering a question. Okay. We talked about this today with one of our quiz questions. Does the question have a positive or negative focus? Is it asking for the best outcome or the most appropriate intervention? Or is it asking something negative, like a barrier or re-education or more education? So that's the first thing you need to answer. Does it have a positive or negative focus? Okay. What are the key words in the question? Okay, we've gone over this over and over again. And I am really suggesting and encouraging everybody to use the highlighter in your ExamSoft software. Okay, because you can, in your first stab at the question, you can highlight what sticks out. Cues, phrases, words. All right, so what are the key words in the question? Then the other thing, a lot of questions can be wordy, and some of the information in the question is really not necessary to answer the question, right? It's just long and wordy. And so try and rephrase the question in your own mind. Okay, make it simple. What are they really asking? Okay, and then the other thing I would suggest you do with ExamSoft is I don't know what they call it, but it's where you can mark out, what is it called? You can mark out wrong answers. The underliner, what is it called in ExamSoft? Does anybody use it? Okay, well, I would suggest that you try and use that. You can rule out options.
It's like a negative sign next to the question, but I don't know what it's called. I use it.
Okay. I think that is a very helpful tool. Okay. And I'm going to add one more to these 4. So these are my 5 guidelines. After you read the question, I would suggest that you not look at the answers. Try and come up with what the answer is in your head. Look away, whatever you need to do. All right. Come up with what you think the right answer is. And then go look at the answers and see if your answer is there. All right. So let's take this first question and go through those 5 things. Well, we can't go through the 5th one because, well, we could, but all right. So a male client with dysphagia, what's that? What's dysphagia?
Swallowing.
Okay.
Swallowing.
Is eating lunch in the dining room of a long-term care facility. The nurse observes the client is choking and coughing excessively while eating. Okay, which nursing intervention should the nurse implement? So let's forget the answers for right now. Let's go down to the 4 questions. right? So is this positive or negative? It's positive, right? Because we're looking for an intervention, correct? What are the key words in the question? Dysphagia, choking, and coughing. Okay, so let's try and rephrase the question into a simpler question. What should the nurse do when a dysphasic client is choking and coughing? And are there any answers we can rule off right out the bat? Rule out right off the bat.
Just don't feed them
Okay,
anything.
so so if you look away and come up with your own answer, is that answer in there?
I can't see.
Okay, the correct answer is C. Okay, transport the client to a quieter environment to finish eating his meal. Think about it. Choking, coughing, anxiety, right? A would not be appropriate, right? They're already choking and coughing. A wouldn't be appropriate. So we can put a line through that right off the bat. Right? Well, if they're choking, we're not going to be giving them a glass of water. Right? So you can cross D off. Right? Because that's going to worsen what's going on. Aaliyah, what are you doing?
Oh, I thought that was mine. I'm sorry.
That's
I was
okay.
doing my own thing. Okay.
So A and D, you can cross off. Okay, so now you're down to 2 answers. Let's say you're attempting to go back for your second round. Okay, so you have dysphagia, choking, coughing. You got 2 answers left. Remind the client to tilt his chin up to reduce the symptoms he's experiencing. What's the problem with that?
He's gonna swallow it
Right. So how do you want to tilt?
downwards.
Down. So you can cross that one out. So you're left with C.
Yeah, that's interesting.
Does that make sense? Let's do another question. Well, here's them explaining it. Okay, the client is experiencing symptoms common to the client with dysphagia while eating. Transporting the client to a quieter environment will allow him to focus on the task of chewing and swallowing, reduce the unpleasantness of choking and coughing. Okay? And it will reduce the risk for aspiration. Then it says, gives you why the other answers are incorrect. Right? A, increase the symptoms. Right? We want to do a downward tilt. Right? And then D, which was provide the client with a glass of water, is going to make things worse. Okay, let's do another one. The nurse assesses that the client's radial pulse volume is 1+ on a scale 0 to 4. Which action should the nurse take to most accurately count the client's pulse rate? Okay, so before even looking at the answers, can you come up with an answer in your head? And is that answer A, B, C, or D? That's the first question. Okay, then we have, is it positive or negative? It's a positive question because you're looking for an action. What are some key words? Pulse volume of 1+. Accurately count the rate. So if you were going to rephrase it to a simpler question, what's the most accurate way to count the pulse of somebody with a weak pulse? All right, and you can automatically rule out D because it has nothing to do with counting a pulse rate. Okay, so I'm just, I know these questions are much more med-surg focused, but I'm just trying to show you the process. Okay? Let's do one more. Ambulatory female who's alert and oriented refuses to take a shower because she's experiencing menstrual bleeding, but states she would like the nurse to assist her with a bed bath. What action would the nurse take first? First of all, what's going on here? You have an ambulatory female, alert and oriented, doesn't want to take a shower because of menstrual bleeding. She wants a bed bath. Is that an issue?
Yeah. She should. I mean,
Okay. So, right off the bat, what are you thinking? She needs to get up and do it herself,
yeah.
right?
Mm-hmm.
Okay, so is there any answer that matches that?
Ask if she needs additional menstrual pads, maybe? I don't know.
B.
I would
What?
say instruct her. the
Maybe D.
benefits.
Yeah, instruct her about the benefits of showering,
Showering. Yeah.
right? We don't want to do, well, let's go to the rationale. Personal hygiene is important, provides additional benefit to the female who is menstruating. Showering offers great benefits. Because there's no contraindication for the client to shower, the nurse should first encourage the client to shower, right? Providing needed reassurance and teaching. Okay. And then that's the reason the other ones are not correct, right? First, you have to, before you document that she refuses, you've got to try and educate on why she should be doing this on her own, correct?
Mm-hmm.
So again, positive or negative? It's positive. What's the first? So what's the first action you would take? That's positive. Okay, what are some key words? Ambulatory, alert, oriented, refuses to shower. Right? So look at the way it's rephrased. What is best to do for an alert ambulatory client who refuses to shower? Right? Isn't that basically what they're asking? And then what can we rule out? Well, we can certainly rule out we're not documenting yet because we haven't attempted to try and educate. Right? So
Yeah.
this is a way to approach questions. Use the highlighter, use the line out for the answers you know that are wrong. Okay, so I don't know if this helps. You may already practice this, but these are tips for attacking questions on the exam. And this just goes through more examples of different questions. So those would be the 4 things that I would encourage you to look at answering questions, but I would also add to that, taking a look at the question before looking at the answers, seeing if you can come up with your own answer, and then seeing if that matches anything. And certainly would encourage the use of a highlighter and the underliner to cross out. I just challenge you to try it. Try these things for the exam next week. See how things go. Okay. I've already met with a lot of you to review exam 1. There's still a few people I want to meet with. Please reach out if you haven't scheduled a time with me yet. Okay. I know we're a few minutes over and I apologize that, but I want to cover those test taking tips. Helpful?
Mm-hmm.
Okay. Any questions? We covered a lot today. Well, I hope you guys have a fantastic weekend. Please reach out to me next week if you need any help. Okay. Use that concept guide as your primary study guide. And then if you need help from that, your supporting documents are your readings, your notes, and lecture recordings. But everything on that study guide, because now we've done week 6, everything on that study guide should be familiar to you. Everything. Don't overdo it. Okay, don't overdo it. All right, stick with what's on that study guide. You should find on the exam. Promise. Okay? Good to see everybody. Have a good weekend, and
Thank you.
you're
Thank you.
welcome. We'll see you
Thank
next
you.
week.
Have a great
I'll
weekend.
see you all.
Thank you. Thank you. You as well. All right, Teresa,
Yes.
what do we need? Hang on.
Mhm.
What campus are you from? Scranton.
Yes.
Well, I mean, you do you want to go?
No,
Do you want
I
to schedule a
don't.
time to go over it, or what
I
do you
don't
want
want to go over it.
I would rather you focus on exam 2.
Exactly that. Now I feel like I need to focus more on exam 2.
Okay,
I would
okay.
love to at least get like an 86 on that.
Absolutely, absolutely.
The quizzes, I'm not gonna lie, they're doing me.
Well, are you preparing for class? I mean, that's what the quizzes are supposed to assess. So I
Okay.
don't know if you're I don't know if you're doing the readings before class, or at least reading the weekly notes that I send. If you're
Two times
not,
I did the blueprint.
yeah,
2 times I did, and 2 times I didn't. I'm not gonna lie.
that's fine. And so the
Yeah.
2 times you didn't, you probably did crappy on the quizzes.
Today I did crap. I
Yes.
did horrible.